Herkese merhabalar. Bugün İstanbul'dayız, Flovel'de. Florence Kilo Yönetimi ve Metabolik Sağlık Merkezi'ndeyiz. Hello everyone. We are in Flovel, Istanbul, which is Florence Center for Weight Management and Metabolic Health. And this is our very first meeting today, and we are very fortunate to have one of the pioneers of the field today with us in this special day. If it's a special day, it has to be the most special guest. And we are very fortunate to have one of my colleague and dear friend from Boston, and Professor Angela Fitch. So she's very, very highly recognized physician, scientist in the field, and we don't have enough time to go through her bio, but basically she's the current past president of the Obesity Medicine Association, and she was one of the co-founders and director of Center for Weight Management at Harvard Medical School, Mass General Hospital. And now she's one of the co-founder and chief medical officer of the Known Well, which is one of the comprehensive and longitudinal Center for Weight Management, which is also one of the pioneers in United States. And a very special model that we are very excited about, Known Well, and very inspiring for the world. Because in obesity medicine, there are lots of problems in terms of like stigmatizing issues and the perception of obesity, not like a disease versus willpower. So we'll talk about all of them. But one of the inspiration for Flovel was also Known Well.
Yeah.
So thank you so much for inspiring us. And so maybe we can start, but you know, Dr. Fitch is in Istanbul for last 4 days.
Yes.
So, and you went through many medical centers
Yes.
in Istanbul. So what do you think about the medical system and the hospitals in Turkey?
I've really been impressed. I mean, this is like amazing compared to, even some of our hospitals in the United States don't have the level of quality and safety and attention to detail and attention to hospitality and welcoming, services. I think it's just been phenomenal to see. I've traveled internationally, greatly, but, as a physician, when you travel, you don't necessarily go visit the hospital. Unless unless in a worst case situation. Exactly. But so it's been so wonderful for your team to show me around here, because it's great to see that there's so much innovation in healthcare happening all around the world.
Exactly. So you're very welcome, definitely. So you're right. So normally you avoid hospitals when you travel. I mean, Turkey is a super beautiful country, but people generally avoid hospitals. Right. But if they need to, they have really, really nice and good ones, very professional. We are proud of our medical system.
Yes. It's
public and private.
Very good.
So, and then you also went through, again, we saw the Flovel together today. So what do you think about the Flovel, our Center for Weight Management here and Metabolic Health?
Well, of course, you have done an amazing job, as I know you would. I mean, this is just such, again, a high level of having not only, assessment and diagnosis, but psychological services, dietitian services, and even physical therapy, right? Many places don't have that physical therapy component, to them, or that physical, activity focus. So focusing on this comprehensive, as we're training people across the world to deliver obesity care in this comprehensive fashion with all of these pillars of treatment, the behavior, the nutrition, the medical diagnosis and medical treatments, and then the physical activity as well. I mean, it's just amazing what you've created here. I commend you.
Thank you. Thank you so much. And so you already talked about it. So the main idea was really being truly comprehensive.
Yes, it's so important. Because obesity is not, obesity is a chronic disease that we have to recognize as something we have to work on, in a comprehensive way. There's not just a medication or a surgery or, a treatment in and of itself, right? This is something we want to really empower people to live their best lives, the highest quality of their life, and the longest life that they can.
Exactly. So, and still people see obesity in the region. It's not just a problem in Turkey, in the region, in the world. So people still see this as a willpower.
Yes.
People still see this as an impossible.
Yes.
So people try everything to lose weight, then they regain, then they get discouraged, feel guilty. Right. So what do you want to say to those patients? And
well, I think, the thing is that there is hope, right? I mean, we have a lot more understanding of it as a chronic condition. I think part of the reason people have felt that way for so long is that it's been treated very episodically. Because of this idea that it's just your willpower, people go out and search for something, a diet, a trend, something to help them do it, but they don't engage with healthcare services that can help them throughout the course of their lifetime, right? In terms of working on it, they just come somewhere and then they go away. So, I think the key thing I would say is don't go away from wherever you've gone to get your help, right? When you go somewhere, you get that medical treatment, you get that comprehensive care, stay there and continue to get that care, longitudinally, so that you're not feeling like it's your fault or your own, need to conquer this illness by yourself.
Yeah, and we know, so we're really inspired by your style as well. So we know you partner with your patients.
Yeah.
The patients, when I talk with them in Boston at Harvard, so they feel like Angela is a personable, like almost they feel like a friend of the family member that's there for years. So it's not like, as you said, for 1 month treatment, you have a glorious weight loss or the fanciest program. But no, so you really go through the entire aspect of it.
Yeah, and it's very normal, I think, for people to feel, because society has always felt. We have data from 500 BC. I know this is a very old region. I'm sure lots of stuff was happening back then, even in 500 BC, where Hippocrates, right, who's the first physician, if you will, said the way that you treat obesity is by curing the gluttony and the sloth. So the idea was planted in 500 BC that you just have to eat less and exercise more, and you will treat this disease. Well, we know now, ever since 500 BC, with the science that we've developed, that that's not true, right? Granted, I'm not criticizing him. That's all they had back then, right? But the idea is that this is not about that. This is not about gluttony. This is not about sloth. This is about biology. And we have learned about the biology and the science for years now. And now we have much more effective treatment than we've ever had from a medical perspective, when combined with our other lifestyle interventions, can really allow us to achieve, in many cases, a 20 to even potentially 30% weight loss, of the amount of weight that we have to lose, right? 20 to 30% of our total weight. We can effectively lose that now and keep it off, as long as we see that as something that is an ongoing work in progress, and not something that we just do quick and stop.
Yeah, I think it's a very important point to point out and let the people know that what 25 to 30% means.
Right.
So when somebody gets a bariatric surgery, then that's the average weight loss people achieve. So, but with understanding the biology and mimicking the biology and all those biological drugs and medications, so we're closing the gap between the surgery and actually the medical treatment.
Correct.
Which also helps for other aspects of obesity and the weight gain. So people should feel encouraged and feel the hope, this care. But it doesn't mean that you just take a medication and you lose weight, you're great. So you need to change the lifestyle, but not with fighting with your brain, if I understand correctly, right?
Exactly. And I think, again, it's normal for people, because of this ingrained feeling that it is something that you can do by yourself. It's normal for people to feel like, well, I don't need that anymore. I don't need the Flowell Clinic help, right? I'm good now. But I encourage people to not think that, right? To always stay connected. And that doesn't mean you have to come in every month, or, in the beginning you might be coming in more frequently, to visit clinicians. But in an ongoing fashion, stay connected to the people that are taking care of you, so that you can make sure, because weight regain is normal. Right? The body does not want to lose weight. Losing weight is abnormal for our biology. So our body tries to fight back and put that weight back on. That doesn't stop just because you've, completed some sort of treatment. That continues the rest of your life, which is, you have to continue this journey you have to think about it as a marathon and not a sprint.
Exactly. And even the fat cells, even if you lose weight, they still act on the previous memory for years. So we have to really treat this as a chronic disease, and really should get the care from the doctors, from the clinicians, from the weight management centers, from the whole team, rather than going the populist and kind of dramatic interventions here and there, and then lose the weight and stop, and all the cycles. And we know the weight cycling actually increase the risk of having heart attacks, strokes, and arrhythmias and everything. That's even more dangerous than actually the weight gain itself. So, and hopefully with all this comprehensive weight management centers in the world, so this is possible. So, but in the same time, people scared about or afraid from the idea of losing weight with medication because of the past. So all the scandalous drugs, I would say, in the last 100 years, really scared people away from an idea of a medication for weight loss. And they all hear something from a newspaper, from the friend, from relative, and about all these medications for weight loss. And I know your center is also doing research for clinical trials for the most advanced treatments, and is very excited. So what do you want to tell us in terms of these GLP-1 analogs, the new ones, the GI peptides, and many more to come? So how should people feel about them?
Well, first of all, they're coming from normal hormones that we have in our body, right? So they're replicating these normal systems that we have. So that is something we can feel reassured about, right? Because and then they're also, they've been around for, we've been using GLP-1 in diabetes treatment for 20 years almost now. So it's not like they're new. They got a lot of new popularity around, when finally, I think, there's a saying that it takes 20 years for something to come about in medicine, right? Like, that it takes a long time for us to really embrace some sort of new technology or new treatment. And so I do think that now that we have more and more effective medications, because our older medications, our older GLP-1s even, were not quite as effective. They started out as twice a day medications, and then they were once a day, and now they're once a week medications in many formulations. So again, it's really, the science has advanced to a level now where people are recognizing it more as an effective treatment. But we have to recognize there's been a lot of people on these medications for the past 20 years. And we haven't seen any significant long-term adverse consequences, which I think is incredibly reassuring as a physician. When I see something that's been used for such a long period of time, it makes me reassured that we're not going to see something, pop up out of nowhere, as far as from a long-term issue. Yeah.
And despite the spotlight, everybody wants to find something. And they do trials, millions in it, and we find something else for the comorbidities.
Yes.
So, and people should really seek out help and utilize the medication as well. And what do you think about the evaluations? Like, for example, when we treat the weight gain or obesity, so generally speaking, most of the people ignore their muscle mass or body composition. Like, what do you think about the initial assessments for body composition, for metabolic rates, and how would you frame those tools to be utilized at the beginning or later?
I think it's very important because we have so much more scientific advances today in terms of measuring these things. So why would we not? Why are we still measuring just people's weight? I mean, it's beyond me. I mean, I just am amazed by it. I tell patients all the time, we do this for the health of it, not the weight of it, right? We're doing this to improve our health outcomes as well, or our function, our ability to get up out of the chair, by ourselves. And so, again, focusing on that muscle health, focusing on getting leaner, not lighter, right? We want to be, I know, this is my little saying in the clinic. Yeah, you can use it. You feel, leaner, not lighter. I think you should put it on the wall. We should make a motto. We should make a flow well, known well.
Exactly.
Collaboration there.
Joint motto.
Yeah, joint motto.
I love that.
Because patients always come in, right? I'm sure you've experienced this, and they're like, I want to be 100 and, now I'm going to say pounds, but, I want to be, I don't know how to do it in kilos. I want to be 150 pounds, right? Like 70 kilos. Yeah. And so they come in and say, I want to be 70 kilos. And you ask them why, and they have some sort of reason, like maybe that was the weight they were in high school, or when
they got married, generally.
When they got married, whatever, event that was, but when they were younger. But we shouldn't want to be a certain weight, right? We should want to be, I think what we want to be, when we, see a picture maybe of a Olympic athlete, who's quite lean, right? We might say, oh, I want to be like that person, right? But that person doesn't ever talk about their weight because they're trying to build muscle and lose fat and be faster and perform better, right? And I think we should embrace some of that ourselves, right? We want to be leaner, not necessarily lighter. And so focusing on that number on the scale is not something we really, want to do. We really want to focus on that body composition, as you mentioned, which is what you're measuring here at the clinic, which we measure also at our clinic and pay attention to. The studies would show that sometimes in people losing weight, especially substantial weight, whether it's surgery or a GLP-1 medication, that people can lose somewhere around 30% of their lean mass, of their fat-free mass or their lean mass, which is this, you want to lose the fat and not the other stuff, right? And so if they're losing 30% of that, we think, well, that's not, we'd like to prevent that as much as possible. Now, we have to level set that in that the amount of fat loss they lose is far greater from a health and benefits a health perspective, right? The fat loss still outweighs the lean mass loss, even if people are losing both. All right. But we want to minimize that as much as possible. We just looked at our data because we have data because we're collecting it, right? If you don't collect it, you don't know. Our patients are only losing 13 to 17% of their lean mass, because we're focusing on eating adequate protein, not just running around skipping meals, because you're on a medication that's limiting your appetite, but focusing on planned portions of plants and protein. That's what I tell my patients, to make it easy about eating, right? Planned portions of plants and protein and getting that protein in and then doing that exercise, right? To maintain that muscle mass, lose that fat mass, and become stronger, not lighter.
Yeah, and this is great. I mean, when you pay attention, and when you're in a comprehensive program, so basically you can improve it 100% better.
Right, and here you do an assessment for patients, even for muscle strength and function. We're not doing that as much at our center. A lot of our care is delivered via telemedicine in the United States, via being able to reach more patients because we can do it, in a video component. But I'm really anxious, even at Knownwell, to incorporate some of this testing functional, sending patients even a grip strength tester, they're like $5 on Amazon, so that they can, measure that and make sure that they're getting leaner, not lighter, right? I mean, getting stronger in the process while also, losing weight is the key.
Great. And with that also, we also ask about, what other conditions you have, and they generally comes as a package.
Right.
They just don't have obesity. They have high blood pressure, they have fatty liver disease, and even fibrosis, and they have coronary artery disease and sleep apnea and all of those. Right. And how would you think about this, maybe even overall, because simply we failed in each of those diseases that started in a setting of obesity, because even the biology is different. So if you have heart failure, if ischemic is different versus obesity-related HFpEF is different.
Right.
And we were not able to treat it. But now we are seeing with the medications that we can really treat them, decrease hospitalizations and everything. So what do you think about treating the obesity-related complications together as well?
Well, that's, again, very important, right, to identify those complications. And we see, as you mentioned, a lot of treatment, a lot of overlap, right, of, our medications now, our GLP-1 medications have indications for those conditions, not just for the obesity, because they do provide such benefits in multiple ways beyond just the weight loss. That's why I said my other little slogan is doing it for the health of it, not the weight of it. Yeah. Because it's really about improving those health conditions, right, that we're struggling with. And if you don't identify them, even like here at your clinic, you're doing the FibroScan for patients, looking at fatty liver and diagnosing that and seeing how severe that is. Because if you don't even know you have it, you're not really, knowing if you're making a difference in that area. And these medicines have such powerful implications to be able to treat those conditions now. And it really is revolutionizing, our care. It's very short-sighted, for people, for us in the world to not have our number one mission to be, how can we get more patients access to this type of care? This should really be the mission of the WHO and other, exactly. I'll put a plug out there, right? That we should really try to prioritize access to this type of care. Instead of, we talk a lot about prioritizing access to healthy, nutritious foods and other preventative strategies, which is still very important. Obviously, in the comprehensive care model, nutrition is a key component of it. We have to have, access to good, nutritious food. But a lot of that focus really is more about prevention of obesity and not about actual treatment. And we know that treatment takes this comprehensive intentional treatment with the use of medications, with the use of surgery, with the use of endoscopic procedures for some patients, and with the use of all of the tools we have in our toolbox.
I think we should nominate you to the WHO head so that in the worldwide there will be like comprehensive weight management centers.
Well, it's the bias and stigma, though. It goes back to the bias and stigma, because there's still this feeling, even at the top levels of the world, that if people just got healthy food, if people just ate healthy, if they just moved more, they would not have obesity. And we really just don't see that in the science. We really know that helping with those things is very important in terms of your energy, your strength, also longevity, all sorts of reasons to have healthful behaviors in your life. But that's not going to necessarily be the only the key to treating obesity,
Exactly.
in and of itself. So
I think it's very important to make that line. So the prevention is extremely important, and we should really emphasize, and starts from the early on, from the even before elementary school, the healthy habits and healthy eating, the natural eating,
planned portions of plants and protein.
Exactly, and avoiding the ultra processed food. It's extremely important. But in the same time, we cannot let a disease, an obesity, untreated. So treatment is necessary. And when we look around in US, like if you think about overweight plus obesity, it's almost 70% of entire population. It's like extremely problematic. And unfortunately, it's not very different in Turkey too, or in the region. So, and I think with the treatment also, people want to live longer.
Yes.
And this is the new focus of everyone.
Yes.
The healthy aging, the health span, lifespan, longevity.
Right.
So what do you want to say about the role of weight management in the metabolic health and longevity?
Amazing, right? I mean, we have good data to show that most of our data, a lot of our data comes out of the bariatric surgery literature because bariatric surgery has been done for so much longer. But I mean, it shows a significant improvement in lifespan. And even as you mentioned, I think more importantly, people want health span, right? You don't want to live longer and then be miserable, like at the end, right? You want to live longer, be able to get up out of the chair, go across the room, make your own breakfast, come back. You want to be able to go play tennis still, do the activities that really bring you joy in your life, and be with people that bring you joy in your life to the longest time possible. And that's really what the data has shown, that losing that 20% of your weight, which is what surgery is doing, right? So it's not, we don't think it's something, sorry to the surgeons, but we don't think it's something magic about the surgery. We think it's that 20 to 30% weight loss that surgery gives that is then leading to adding 8 years to people's lives. I mean, that's the data from the bariatric surgery literature, that it can add 8 years to a person's life that has obesity, right? If they are able to lose and sustain that greater than 20% weight loss. And that really takes it might not sound like a lot just sitting here, right? Like if you're thinking about, again, we work in pounds in the United States, but if you're 250 pounds and you lose 50 pounds, that's 20% of your weight. A lot of people think they can lose 50 pounds, like with just some sort of diet. But the data shows that lifestyle intervention alone, focusing on your nutrition, focusing on physical activity, your sleep, your stress, doing that, only 5% of people are able to lose 20% of their weight with that sort of intentional treatment. But when we add medication, for example, now we're getting with our latest medication, which is a GLP-1 GIP analog, so it activates 2 of our naturally occurring hormones. With that medication, up to 70% of people are now getting that 20% weight loss, right? 60 to 70%.
Hundreds of millions when you think about the world.
Right. And so you went from a 5% chance of doing that with your diet and exercise plan, which is great. Everybody should do that, right? And we should find the 5% of people, because if 5% of people don't have to take a medication, that's great, right? I mean, they don't have to take medication. They're what we call lifestyle responders. They're responding to that treatment, that intervention. And then if you can layer on top of some of these medications and now get 60% of people into that 20% weight loss category, that's why these medications have reached so much attention too in the world, is because of the fact that they're powerful enough to be able to do that, right? When we have 5% of people doing it with some sort of, in the United States, we have all these programs, Noom and Weight Watchers and all these types of, programs people do, Jenny Craig, where they send you the meals, When patients do that, 5% of people able to lose 20%. Now we have 60 to 70% of people losing 20%. That gets noticed. I mean, patients notice that. Is the fact, you notice, after COVID, you came out and you're like, hey, you see your neighbor, you're like, wow, Joe, you look, like it's noticeable when people lose 20%, right? It's not as noticeable if people lose, less, right? And so the more people are noticing, because now there's, 60% of those patients, 6 out of 10 are getting that amount of weight loss versus,
responders increased dramatically. And that tells us that we really need individualized and personalized approach to assess all your needs, from psychologically, from nutrition, from physical therapy, from exercise, from medication, maybe more in endoscopic procedures to surgery. Like there's a big spectrum from really from that 5% all the way to...
Yeah, and some people need to lose more than 20% for whatever reason, right? And so again, then, that's where we start layering on top with, different types of treatment, in order to get the best result, which is what we've done in medicine all along, right? For cardiology, we have, you might have just take a medication. You might need a stent, something put in your heart. You might need open heart surgery, to revascularize your vessels, to reorganize things. So, I mean, again, there are so many different, treatment options, but we should really start to embrace them more and use them more intentionally in order to really see a difference in the outcomes of our longevity and our health span.
Exactly. So thank you so much. So is there any other thing you would like to add, or any final comments? It can be like Istanbul, Turkey, region. You're in Spain. This is the Mediterranean countries.
I know.
It's fun, and
I'm ready to move. I think, or at least come visit more often.
We should work on it.
Come visit more often, because I mean, this has been you have such a beautiful country, and it's got so much history and so much hospitality. The hospitality here is just amazing, and I will just say, Evola.
And it's one of the important piece of longevity is the connection and the people around you. So the people should seek help, but together with their loved ones. So you don't want to live 120 years alone. You want to enjoy your loved ones. So hopefully we will all
embrace the
Eyvallah and then come to Turkey.
It's the one word I learned.
Exactly. That's a good one. That's good enough. When you say Eyvallah, that's fun.
The other ones are harder. That was a pretty...
Eyvallah is good enough. I think that will keep everything with the appreciation. So thank you so much for coming.
Thank you.
We're really honored to have you here. And thank you so much for what you're doing for the world.
Yes.
That how really... from a stigmatized problem to really treating a very important disease that affects more than 1 billion people. And now people feel the hope. And I can tell you, like really people start seeking help, and all of parts of the, from Europe to Asia to Africa, everybody's like starting their initiatives, and they're really learning from you and encouraged by you and empowered by you. So we are really thankful what you're doing for all these decades. I know it was a tough field to start. We're talking now, we're glorious now. But I know how tough and how hard it was to go through and almost alone and fight with even medical systems to everything. The governments to
and we still are on that journey, right? And I encourage if patients are listening, to reach out. There are patient organizations like the ECPO, which is the European Coalition for People with Obesity. It's the patient advocacy arm. So, find your community, as you mentioned. That community is important to support us. And thank you for what you're bringing to Turkey here, as the region can really benefit from Flowell.
Definitely. We are really thinking the Flowell is like an excellence, center for excellence for weight management and metabolic health for the entire region. And we are hoping to collaborate more with the world and try to tackle this problem all together. And again, thank you so much for coming. And hopefully we're going to continue these programs. And everybody welcome here. And thank you so much for listening to us.